Welcome home. We are WNST, AM 1570, Towson, Baltimore. We are Baltimore positive and positively getting the Maryland Crab Cake Tour back out on the road. In the aftermath of opening day, we're going to get back at the Cocos. I'm going to get back at the Costas and Timonium. But in the meantime, we will be at Missoni's on Tuesday. First time at Missoni's in Perry Hall. It's all brought to you by the Maryland Lottery. I will have the Harlem Globetrotter scratch-offs to give away for a limited time. We're going to get those beautiful Maryland artistic renderings coming in April after opening day as well. It's also brought to you by our friends at Farnan and Dermer, our HVAC folks, the comfort guys, and our hospital partners at GBMC, where I'm always talking about the good things they're doing here in the community and always having docs on. And we're doing a walk a mile in their shoes in April on the 17th. I'm committed to that as well here in Towson. So I like talking medical stuff. I like talking insurance stuff and doctor stuff because it really becomes real life when the bill comes. And I know for anybody that's followed my journey and my wife and her cancer and Johns Hopkins and insurance and 9/11, and my wife is in the Zagroba Act and the program and I've done a lot on Obamacare and Maryland Health Connection and the criminal run in the country and just everything that's going on here. But on the 19th of March, it's come to my attention that one of my favorite theaters, the Senator Theater, is airing a film, and it's got a sort of a title that I'm like, Suck It Up Buttercup. Suck It Up Buttercup. I have heard that expression. It's never, that's sort of like rub some dirt on it and get moving. An investigative a documentary about physician burnout, which we've discussed here, corporate greed, which is a part of our lives, and the systems that can still save us. Here to discuss this, and I love when I have doctors on because I know I'm about to learn. Dr. Terry Mulligan. Terrence Mulligan is an emergency physician and adjunct professor at the University of Maryland School of Medicine, and also a Harvard Medical School alum. And where'd you grow up? I ask that question, Doc. Where are you from? I'm from Dundalk. Where are you from?
Well, I grew up in Detroit.
All right.
Um, and to me, I love Baltimore because I think if I turn around three times and open my eyes and I'm in the middle of Baltimore, actually, it reminds me of being in Detroit. A similar feel, old brick buildings, pre-war, except Baltimore has people, whereas Detroit has now become kind of unpopulated. But
Yeah, I mean, I've been coming to Detroit for 35 years. Tiger Stadium, Lindell AC, the Joe, all of that, Cobo Hall, all that stuff. Even with Kiss was there. But I think for cities and the administration that's running the world right now, picking on cities and picking on poor people and picking on immigrants and picking on all the things that built Baltimore four or five different times as we go through the generational of what makes Baltimore great. The port city, it's got great bones, great history, just all of that, Civil War battles, all of the what we have here. And I guess we're celebrating 250 years this year, so we can talk about Federal Hill and the
Mhm.
British and all of this. But we're a medicine city around the world, right? Right. I would think
Oh
people
yeah.
think Johns Hopkins, we're a medicine city, right?
Well, that's right. Hopkins and also University of Maryland. University of Maryland. I've been working there since about 2006, and I'm still an adjunct professor there. University of Maryland is the School of Medicine is the third oldest medical school. It's the also the oldest dental school, the first dental school, the first school of nursing. It's the first medical school that came before the university. So this medical school was actually founded before the university was founded in Maryland, and it's one of the biggest state hospital systems. And of course, Hopkins is world famous research medical research institution in the world, and so. Maryland's also the one of the first statewide ambulance systems, the first trauma system, statewide trauma system, with shock trauma being along with Chicago and LA, the first trauma hospitals and statewide trauma system. So yeah, it goes back a long way.
Well, my wife was battling 12 years ago at Hopkins. All you have to do, I mean, we would go for walks to try to keep her alive at that point, right? And that dome that's there and the history that's there and the bones and the bricks that are there, Henrietta Lacks, we can just go through the university, just all of that. Um, I remember back in the beginning of COVID, we shut the city down. Brandon had to shut the city down, and there was a lot of conjecture about. And I thought Baltimore is the one place when Seattle had the breakout, New York, we're seeing the ambulances, seeing the trauma, people are wearing masks. I thought we're the one place that can't go down. We have too many doctors, too many hospitals. We're important. We're near DC. That when the manure hit the fan big time and the world shut down during our lifetime, Baltimore is one of those places we had to protect even more. And I don't know that the business owners understood that, or shutting down businesses, or, all, because this is where I lived. I lived at the Inner Harbor for 19. This is literally out my window. I lived at Harbor Court for 19 years. So I saw the good and the bad and the ugly, but I could see my wife's hospital. If you look right there, I could see her hospital room where my pen is going, because that's Johns Hopkins, and the Zayad, just all of the things that I've seen in medicine in the city as to how important our city is. And then I think, well, we have too many damn hospitals because we have too many damn sick people. Don't we want less sick people? And I guess that's where Suck It Up Buttercup maybe comes in here. And there's my radio segue for you there, Dr. Mulligan.
Yeah, well, of course, that's what we're all trying to work towards is make people well and live better, live longer, live more healthy and happier. And I don't know if necessarily having less hospitals is the way to do it. But yeah, I think we've kind of backed ourselves into a system that we found, especially over the last 20 years or so. But for the last 50 years or so, we've been moving towards a system that I think nobody really wanted. Nobody really designed it. We kind of have wound up with a system that doesn't work. It works for the people who own the subcomponents of the system, but I don't think it works for patients. It doesn't work for the public. It doesn't work for public health. It doesn't work for even health professionals like nurses and physicians and other people working, giving clinical care and then doing the public health piece. And so I think we've kind of wound up with a system that is limping along and doesn't really work. It works for the few, but not for the public.
My wife's two bone marrow transplants and leukemia, and for Neil, so she'll be seeing in Italy in a couple of weeks, in Europe, who saved her life twice. He always likes to say that I did it twice. He's
Mm,
German. And to think of the complexity of all of that and watching my wife have her life saved and comas, all of that, and coming out of it and doing this instead of arguing about the Orioles and the Ravens all day long, although I'm happy to do it portion of the
mm,
day
mm,
as I get older. Um, it was millions of dollars that saved my wife's life, insurance, her employer who sent her in to 9/11, and then the American government and the Zagroba Act that's insuring her, hopefully for the rest of her life. It concerns her. She's diabetic as well, so she's tethered to the health system completely. My wife's life is tethered to the health system.
mm,
Like she's this close to being diagnosed as not diabetic anymore, to take pills instead of the shots she's been taking for 38 years. So,
mm,
I mean, my wife makes appointments, her eyes, all of this, and where the insurance is, and where the system is, and where the red tape is, and where I was as a traumatized caregiver in her filling out all of her own medical forms when she was bald and weighed 85 pounds and had wrists the size of my pinkies. Like and we're smart people, we're educated people, we're not affluent by any stretch of the imagination, but we had insurance. We didn't
mm.
wind up on Skid Row because of it. I just I know the challenges we've been through, and I'm a really healthy dude don't tell the people at GBMC that, but I think I'm healthy at least today. So far, 58, 50, I'm okay. But I've had surgeries, I've had outpatient, this, that, bills, all of that. I've never been driven out of business or had that concern up all night about how I'm going to pay for things, where my next insurance is going to come from, where my next vial of insulin is going to come from. And my wife lives for that, right? Like she's tethered to it
Mhm.
every minute of every day with that. I would say DC is failing us, and I had Kwesi on last week, and I had Johnny O. I mean, and I could talk to all of them, but really capitalism. Wonderful concept. Wonderful. We talk about it all day. It's built the whole place. But whether it applies to healthcare and social welfare and a safety net, the people in Scandinavia and a lot of other countries in the world would say, we might have won in hockey. We might win in baseball this week, but we're not number one. We're just not. We're amazing at developing medicine and saving lives. We're terrible at taking care of our citizens, our humans, with the outcome of stuff that, you know, the original doctors 300 years ago would marvel at how far we've come. I marvel that my wife is alive because when they said leukemia, I thought Brian's song, I thought my wife's going to die. She's in the
Yeah.
other room.
Yeah. Well, I mean, I hear what you're saying. You know, I think capitalism is not a force of nature. It's something that we designed as, human beings, and it's not even old, ancient in terms of human history. It's only, 600 or 700 years old as a human endeavor. And capitalism, I think, is like a fire in the fireplace. Fire in the fireplace is good. Fire in the boiler of your building to heat the building is good. Fire in the forest, burning down the forest. Fire in your living room, burning down the furniture and your curtains, uncontrolled, is not good. And so capitalism really needs rules and needs a system that it can operate in. And in medicine, in a lot of sectors in the U.S., but especially medicine, we do not have capitalism. We don't have this kind of self-correcting, self-governing, regulated system that consumers or patients or people who are involved in paying for it as a product can make choices and then come up with a system that winds up working for everybody. So that's not what we have in the U.S. We in fact, I don't think the healthcare system is broken. I think it's fixed. I think it's designed to operate in the way that it operates, and the design has very little to do with giving healthcare or even appropriate medical services to people. And so that's something we need to we all need to recognize that. And we have to decide collectively somehow whether this is something we want to continue to put up with.
I'm going to read about the film. The film is called Suck It Up Buttercup. My guest is Dr. Terry Mulligan. The U.S. healthcare system is facing a multifaceted crisis. This is a documentary to drive change. It is a purpose film. It's at the Senator. It's on the 17th. Did I say 17th? I get that right?
19th,
19th. I'm
19th.
sorry. I'm thinking St. Patrick's Day. 19th at the Senator. My bad.
Mhm.
Suck It Up Buttercup is an investigative, emotional, solution-driven film featuring. So we have a solution. I like when I like cliffhangers, but I like it better when like give me a way we fix this, right? So featuring physicians, clinicians, patients, and other key stakeholders, exposing the frailties of the U.S. Healthcare system in terms of corporate greed, which we can't agree on anything in this. We can all agree that there's a lot of corporate greed going on in pharma. Systemic bureaucratic failures. I've seen some of these folks. And a deteriorating work environment. I've spent a lot of time in hot. Do you know how many fights I had with the Johns Hopkins people? The guy who was running Johns Hopkins at the time got on the phone with me when they brought my wife, who was neutropenic and dying, a bouillon cube and boiling water and told her it was nutrition in
Mm.
the cancer ward. I lost my mind on how bad the food was in the hospital, just so I'm throwing that out. Man, you could put me back there in a minute, Doc. She spent
Yeah.
151 nights in Hopkins. It doesn't take much for me to go back and be so incredibly inspired by the doctors, by the nurses, by the medicine, by the care, by the tears, by people's true incredible concern. My wife was at a teaching hospital, so interns, doctors would come around every day. There'd be 15 doctors in there every day trying to figure out what the hell was trying to kill her. Turned out it was 9/11, which we didn't know until afterward. But like, I have so much respect for all of the research. I've raised money, I've given speeches, I've hosted dinners, I've done all of that for 35 years, and I know how far we've come. I got proof in the other room.
Mhm.
If she was her mother, she'd be dead a generation ago. Steve Bisciotti lost his father. A Ravens owner lost his father to leukemia in the 60s. He grew
Yep.
up without a father because his father died of leukemia. I know I'm connected to that world now, so I see survivors, Eric and Michelle and people that found it. There goes my hero. And I think about all of that, all that good stuff, all that amazing stuff, and the magnanimous people in Europe that helped save her life, and doctors over there, and all the science that went into this, and all the research, and people swabbing just for my wife, just in my space, so my wife can be alive, and think about the insurance company at MetLife that tried to force her back to work when she wasn't ready to go back to work. And
Yep.
the bills that came with big zeros on the end, and then the government, these creeps like Mitch McConnell trying to go in and take her insurance away, so that Jon Stewart had to go to politicize that my wife should have insurance the rest of her life after going to 9/11 on September
Yep.
13th and claiming.
Yep.
So, like, that's my personal bitch story complaint about this. So I love that a film has been put together that my wife might want to see, other people might want to see, to say, how can this be better the next time around? How can we make this better? Because we've made the medicine better. We're not even trying to make the system better, Doc.
Well, that's part of the reason the title was chosen is that "Suck It Up Buttercup" is the ultimate that all of us are facing when we're dealing with the healthcare system, whether we're patients, and you've described your experience with this. You don't like it? Tough. This is what you get. This is what you get when you don't have insurance. This is what you get when you do have insurance. This is what you get when you go to the best hospital system in the world. You don't
Doc,
like
I
it?
got to tell a story. My wife was nauseous during this whole thing, and she had a patch that was keeping her from throwing up. There was a lady in the next room, and I don't know if she lived or died. We kind of think she was struggling. She had three kids. They were in Northern Virginia. Husband. She was in her 30s, man. I mean, and the family would come up on the weekends, kids in the hallway, mom's dying. It's awful. Um, she's throwing up. Her insurance didn't cover these patches. They were like $400 a piece. My
Mm.
wife had a stack of them sitting there.
Yep.
Of course, we gave her the patches.
Yeah. Yeah.
Like it was insane, the
Yeah.
shit we saw.
Yeah.
Insane. So
Yeah.
I
It's
apologize, but you got the wrong host today, Doc. Sorry.
well, I mean, it's
Maybe you got the right
uh,
host.
well, I think we're on the same page. You as patients and just as citizens, we've been upset and dissatisfied and uh, unbelievably angry, justifiably angry at our healthcare system for a long time. For a long time. But now it's not just patients and the consumers who are getting screwed. It's everybody who's involved in the system, people who work in the hospitals, the physicians, the nurses, all the multiple health professionals who are providing care, everybody trying to do their best, like you mentioned, seeing the students and the residents learning, trying to learn how to help people.
It was a resident
And
that diagnosed, a resident from Saudi Arabia, excuse me, Egypt, who diagnosed my wife's illness, found her leukemia, and
Mhm.
like at Hopkins,
Yeah,
literally.
yeah,
It's
I
an
mean, and so
incredible international effort. Incredible how the
it's
world comes together to save
yeah,
lives in that
yeah,
way.
yeah. And so uh, I'm really, I think the movie winds up talking to the unbelievable frustration and anger that you're exhibiting, and you're justified in exhibiting that. What's more tragic? Somebody having pain and suffering because of a diagnosis for something that we don't know how to fix yet. So most cancers we don't know how to fix yet. A lot of heart disease we can manage maybe, but we can't really fix it. There are a lot of things that we have not figured out. We in the medical world, we in the scientific world, just we haven't figured that out. That's a tragedy. But what's worse of people dying and having suffering from things that we do know how to fix, that we do have the medicine for, we do have the science for, but we're choosing not to deliver it. We're choosing not to distribute it. We're choosing not, we meaning the system that we work for. I think that's a double or triple tragedy. It's a crime. I think it's worse than just being tragic. It's unnecessary, and it's unnecessary for the complete wrong, unnecessary reasons. So, I got involved with this film because I'm an emergency doctor, and I went to medical school, and they teach you how to take care of patients, but they don't teach you how to build the system. They don't teach you how to build the healthcare system, what a healthcare system is. I think most doctors, most people don't understand how the healthcare system even works. And I became really interested in emergency medicine. And then I got involved in global emergency medicine development. So, how to build emergency systems and trauma systems in other countries. And so, for the last 20 years, I've been working in 40, 50, 60 countries, 4 or 5 months a year, helping build emergency systems. And I see, systems overseas that work and systems that don't. And while there is no perfect system, there's no one system that fits everything. There are a lot of similarities between systems. And I felt like coming out of my training, I didn't understand how systems worked. And if I was going overseas trying to teach and work with people building their emergency systems, their trauma systems, their ambulance systems, disaster systems, I really had to learn more about the healthcare system. So I kept going back to school and back to school and back to school after my emergency training. And I became kind of a pseudo expert in healthcare systems and global healthcare systems. And after all of this 15, 20 years of learning, I kept expecting that I was going to come on I was going to stumble across the thing that I had been so confused about for so long. What was it how come our system is so broken and how come it doesn't work? There must be some arcane, hidden health economics set of laws or rules that I just didn't understand, that most people don't understand. That if they only understood this, economics and business and the way insurance works and the way that actually they would see that it has to be the way it is. But you know what? I was mistaken. After studying this for 20 years and all around the world, especially in the U.S., the, the reasons that it's the way it is in the U.S. especially, it's not because of some arcane set of health economics laws that means the healthcare system has to be horrible the way it is. It's this way on purpose because it's designed to benefit a different set of priorities than the priorities that we think it should be designed for. We think it should be there to help people, to help them when they're sick, to help them stop from getting sick, and to stay healthy. And it's just not designed that way. It's more designed, especially in the last 20, 30 years, more designed like a business, designed like a business to deliver profit. And it's designed to deliver profit to a very, very small number of people who actually own the companies and the major stakeholders, the insurance companies, pharma companies, some hospital groups, and a couple other small like device companies. And so, we're not part of this calculation of theirs. Patients are there to pay the premiums and then to shut your mouth and take what you get. Suck it up. You don't like the coverage, you can get insurance somewhere else, except the insurance somewhere else is pretty much the same or worse than the one you got. So, if we were talking about buying products like a car or you're buying a house or so you're going on the market trying to buy something, if you don't like the quality, if you don't like the price, you can choose not to buy it. And then that helps, change the market and somebody will come up with a better product for you. But we can't do that with healthcare. Healthcare is this grudge purchase where we have to consume healthcare. Or the alternative is you get sick or you suffer or you die or your family does or your children do. And so we have to choose and take the things that they're offering to us. And they know that. They got us where they want us. I have one of these I have a cartoon in one of my lectures. There's a mama and a daughter sitting on a couch. And the daughter says, "Mama, how does the health insurance work?" And the mama says, "Well, first they collect these really giant premiums." And the daughter says, "And then what?" And the mama says, "Oh, that's it." they collect the premiums, and then they do their best to not deliver it, not pay, not provide the services. And now we're seeing it reaching all the way down to physicians, nurses, everybody who's delivering the care is now burning out not just because of overwork and underpay and understaffing, deliberate under-resourcing, deliberate understaffing, deliberate overwork, because that makes money for the organizations that are, we work for. But it's doing it in a way that it's this double or triple tragedy that I talked about. I don't think most people are not afraid of hard work. I know most doctors and health professionals are not afraid to work hard, and we got into it knowing we were going to work hard. But I want to work hard towards something. I want to work hard for the right reason. I don't want to work hard to do double or triple work in order to make 1% of the people who own these companies rich, and at the expense of human beings and their pain and suffering and their lives. It's just, and so that's the Suck It Up Buttercup. That's the message. Is the system is telling patients, you don't like it, tough. It's telling doctors, nurses, you don't like it, you can quit and go work for the hospital across town. Except, you know what? They pretty much are going to treat you the same way. So, and I think we're working for a system that is designed to run healthcare like a business. I don't think there are, that many evil CEO like Mr. Burns types who are really, evil bastards who are responsible for all the major problems. Although, of course, we have our share of those. I think it's not so much the bad human beings. I think it's the machine that we have built, or the machine that we have allowed to have been built. And that
Well,
we're
the
all
cynic
stuck
in me
with
would
them.
say it's about the politicians in DC and money that influences both sides of the aisle and the middle of the aisle and
Oh
anywhere
yeah,
else. When you're talking about, to your point, this isn't about gas and cars and transportation. Yeah, that's important. This isn't, it's not about the jobs or this is about healthcare, and all of us are going to need it at some point. Even those who
yeah.
think we're really healthy, we're all going to need it, and we all know, like everything else, the cost of it, it's not optional. It's like
Right.
having a cell phone like having a mobile. There's just
Mhm.
certain things, vehicle, if you live in certain places that are built in, that all sounds
Yeah,
great. There really are, all of these are
yeah,
optional when you're
yeah,
sick. When
yeah.
diabetes, there's no optional. My wife having insulin today, none, zero. She,
Right.
without it, she's dead by the end of the week, right? So that that's a whole different level of, we got you by the short hair. No, you got the short hairs. You got all of, you got
Got
all of
everything.
me.
Yeah,
You got everything
yeah,
when you talk about
yeah.
health. So the film is on the 19th at the Senator. I'm assuming this will be available in other places, but it's being premiered. Give me a little bit about the film, Doc, and I'll let you roll, and we'll send everybody out. Suck It Up Buttercup film. You can learn more about it. There is a solution provided in this film, and I don't know if you want to get into that. I don't think you want to keep it too much of a secret. But encouraging folks to come out and learn about these issues that affect all of us, and at a level where I think everybody that sees the film will learn something about this, right? Some little nuance of, holy shit, they're doing what? I'm sure there's a little bit of
Yeah.
that, right?
Yeah. Well, I mean, I don't think I think the healthcare system now is probably at the bottom of the rung of businesses or parts of society that people are the most dissatisfied with. You probably have politicians and congressmen, and then maybe your healthcare system, like right at that level, of people being
Well, you pay
dissatisfied
your
and
healthcare
mad.
system. Everybody's paying for their healthcare, right?
Yeah, and
And
we're paying unbelievably high amounts, and we're not getting, not only are we not getting service, we're getting worse service every year. It's like if you bought a new cell phone every year, and next year it's twice as much as it was this year, but it has half the functions. And then 2 years later, it's twice as much from there and has half the functions from there. And so the only real strategy that insurance and the healthcare system has been delivering outside of the scientific breakthroughs from year to year has been to raise their prices. So I think this is the healthcare system in the top G20 or G50 countries. The top 50 countries, healthcare sector is the number one, two, or three biggest sector. We spend $5.3 trillion a year money goes through the healthcare system.
Even in healthy
And
countries, even in the healthiest places, right?
yeah, and healthcare is expensive. Lots of things that we do in society are expensive. Education, the judicial system, the democratic system, where it exists. There are a lot of things, the infrastructure, the plumbing, the electrical grids. These things cost money, and we, as a society, we elect and decide to pay for it. But there are certain sectors where, that, like you mentioned, you get the policy and you get the laws that you pay for. You get the policy that you lobby for. It's the best democracy money can buy. With this legalized lobbying, legalized bribing, you get the policy that favors the incumbents, and it favors the stakeholders, and the major stakeholders being insurance and pharma and major hospital groups. And the physicians, the healthcare workers, we're really kind of pawns in this system. But the real ultimate pawns are the public, the patients. Um, so the film is on March 19th. The website is suckitupbuttercupfilm.com. You can go there, and there are multiple different levels of tickets. You can see the movie in person. You can see the movie and have there's a 30-minute question and answer session afterwards. There's also an opportunity to go to a kind of a banquet we have down the street right after the film. And the film has a lot of like healthcare professionals, doctors, patients. Mark Cuban is in the movie. Don Berwick, who used to run CMS, Center for Medicaid and Medicare, under President Obama, is in the film. And I am featured for about 30 seconds or so.
Oh, you
Um,
always you got
yeah,
15 minutes here at least, right? So,
that's right. And I think it'll resonate. People, anybody who is a patient or somebody who's worked, we've all had our interactions with the healthcare system, and I don't think anybody is 100% satisfied with their interactions with the healthcare
can
system.
I ask you, because
And
you're a real expert on this, you've been around, I mean, obviously, where's it great? If you could pick a system and say, we got the best, we have more money than anyone. We're the greatest society in the history of societies. If you ask Trump or anybody else, we're further along in all of these things. Let's buy the best medical system we can import it. Like the NFL does this when there's an offense or a defense. They just steal it, right? Let's just steal that idea. That's what they do in industries everywhere. What would be the idea we would steal, Doc?
yeah, well, I think unfortunately, it's not one thing, but I could say there are about five or six things. One thing is something you mentioned earlier. A lot of places in Europe, in Northern Europe, Scandinavia, also there are a lot of other high-income countries, not just European, where their healthcare system is fantastic. And part of the reason is because, in general, I found this out over my 20 years experience. There are a lot of other countries that are better at treating the herd than they are at treating the individual. And the herd needs to be covered. The whole population needs to have health care, preventive health care, public health, and coverage for the medical problems when we have them. So I had a professor teacher, one of the fathers of emergency medicine, Louis Goldfrank. He's the chair of Bellevue Emergency Department in New York City. He said, every person who presents to the emergency department represents a failure of the public health system, which means if we had a perfect public health system, we wouldn't need the emergency department. We wouldn't need these major hospitals and medical care the way we do. But we don't have a perfect public health system. Some of it is because we haven't discovered everything yet, but some of it is because we have discovered things, or the world has discovered good ways to provide healthcare, but the system has decided not to do it. And in some cases, individuals have decided that they like the system that way. And so I think one of the solutions is we need to concentrate on providing healthcare for everybody. And the insurance system, the concept of insurance, is actually a very good, very economically sound system, but not insurance for a profit, or insurance for a profit at any cost, with any regardless to the negative consequences. It's kind of like if the fire department shows up at your house while your house is on fire, they can charge you whatever they want. They don't charge you at the time when your house is burning. We shouldn't charge people when they're sick. We shouldn't. We should have a system where the coverage is there and it's covering everybody, and it doesn't cost more than your house mortgage to pay for insurance that then doesn't cover when things get really tight and things get really rough.
Well, we're talking about healthcare. Dr. Terry Mulligan is here, and you're local, or as we say around, you're
Oh
local,
yeah.
hon, right?
Yeah, sure. I live in Mount Washington. I have done some moonlighting work at GBMC. It's a fantastic institution, and yeah, I love the healthcare environment in Maryland is robust. It's very well developed, but we are victims of the healthcare system designed the same way everybody else is. So I think we have to move away from a competitive system where insurance is fighting for its bigger slice of the pie, and it's fighting pharma. It's fighting for its slice of the pie, and the hospital systems are taking whatever the insurance and pharma decide to give them, and they're fighting for their slice of the pie. But they're all fighting. So it's like three boxers in a boxing ring fighting over the prize money, which is the 5.3 trillion a year.
And meanwhile, the
And
lady in the room next to my wife who's dying can't get a patch to stop throwing up. I mean,
that's right.
like
That's right.
insane, insane.
So we need to move from this fighting competitive system where they're fighting against each other more to like a cooperative system where imagine these three fighters rowing in a rowboat all in the same direction. So that instead of having a competitive system, we have a more cooperative system. I think that works and it provides better care. It ultimately could provide for profit and the ability for people to make a living doing healthcare. Um, and we know the way our system is now is making some very small percentage of people who run and own insurance companies and pharma companies and hospital companies, making them insanely cartoonishly rich, and it's at the expense of our family members and
The people doing the
ourselves.
work too. The people doing the work,
Well, and us,
literally.
yeah,
All right, I'll get
yeah.
everybody out for this. Suck it up, Buttercup. That's their message to all of us. An investigative documentary about physician burnout, corporate greed, and the systems that can still save us. Dr. Terry Mulligan has been a good chap and it says right here on your LinkedIn, it says here adjunct professor. So you teach this stuff. So I mean, yeah, and you did a very good job of teaching me and dealing with me, keeping me in line as well. And I can get a little animated talking about the insurance system and medical system because I've been involved in it. So good luck with the film. It's the 19th of March at the Senator. You can find all the information out at suckitupbuttercupfilm.com. Thanks for coming on, Doc. I appreciate you.
Hey, thanks so much.
My appreciation to Karen for putting this together as well, and for all the doctors and nurses and friends and people and the folks who took care of my mother when she was older in life, and just I did a whole thing on kindness earlier with the Secretary of Kindness in Salisbury, Maryland, Grace Foxwell Murdoch. You want to check that thing out too. But we're finding ourselves around here because he's not going to be president forever, and we're going to have to piece this thing together in a better way. I'm Baltimore Positive. Stay with us.